Hello, I am Chris Pickard. I'm Director of Body and Balance in Hertfordshire, and today I would like to talk to you about two of the biggest mistakes and two of the biggest myths that stop people with disc problems getting better. If you fall prey to any of these things, the chances you're actually getting better diminish to almost zero. So, I'm also going to give you the solution to these problems as well. Now, for those of you that, for instance, don't know what a disc problem is, most people associate it with just back pain, but it can also cause neck pain. It causes stabbing and shooting pain down the arm or leg, causing sciatic pains. It can cause burning pains. It can stop you from sleeping. It can stop you from moving. It can stop you enjoying your sports, playing with your children, your grandchildren, interfere with all your normal hobbies. It can literally suck the joy of living from you. And so our patients who get out of pain and feel well again commonly say, I feel 20 years younger. I can move again. I've got my life back. Thank you very much. And our procedures, our program has a 90.5% success rate. So where did this all come from? What happened? Well, let me tell you a little story. It's my story of how I came about and do what I now do. When I was a teenager, I got hay fever. And you may be thinking, what's hay fever got to do with back pain? Wait for it, we'll get there, okay? Basically, I got hay fever and my mum had hay fever as well. But she had found that when she was getting chiropractic care, her hay fever was a lot better. So they took me to the chiropractor and my hay fever got dramatically better. And so I became inspired to be a chiropractor myself. And when I was at chiropractic college, I found out that most of the people there were there because a chiropractor sorted out their back pain. I thought, wow, back pain? Really? I had no idea. I thought people went to chiropractors for pretty much everything else, just to avoid medicine, to make sure their nervous system was working better. And so I went through college, and my very first patient was someone with back pain with a trapped nerve down the leg, down the front of the leg. It was something called myalgia paresthetica. And she'd seen her medical doctor who'd actually tried to do a bit of a chiropractic maneuver on her, and it made her worse. So this made me a little bit nervous. And because especially when I got her into the same position and she said, yeah, that's what my doctor did. That's where he got me. And I did a little bit more and it moved, and she immediately got up and felt a lot better. So I thought, fantastic, I've got healing hands. I can cure the world of back pain. Of course, it only took a year out into the real world when I realized that this wasn't going to be the case, because I had this patient who had had chiropractic previously. She was a young lady and we treated her and she got better. And then 6 months, 8 months later, she came back again. It took longer to get her better. And then we made some modification to what she was doing, exercise. And then she came back again and it was worse. So we made some more modifications. It took a bit longer to get better. And then she came back a fourth, or it might have been the fifth time, and it was almost impossible to get rid of until we also changed her diet as well. And it was once we changed her diet, we had the chiropractic procedures, the right exercises, all these things came together, it got better and it stayed better and it never came back. And that was 20 years ago. So since then, I've been doing a lot of research into what really goes wrong with discs, because so many people come to us with disc problems and back problems and neck problems, and they haven't happened with a specific accident or injury. They've happened out of the blue. So this is what we now know happens with discs. So here's a model disc, okay, in the lower back. And very often what happens is with a slip disc is it's actually not a slip disc, it's where the central part of the disc, which is a softer part than the outer part, actually breaks through, hits a nerve and causes pain. But what we know is it's actually, very often it's just the nerves in the disc itself that are getting inflamed for various reasons, because the outer layers of the disc, okay, they can crack, okay, and the inner part seeps through. And as these crack, because they become dehydrated, and they become dehydrated because discs, to stay nourished, they like to be moved. So if you're sitting down all day, your discs won't get nourished by movement. If you're not drinking enough water, they'll be dehydrated. But also, if you don't have the right nutrients, you don't eat the right foods, you don't get the right chemicals that suck moisture into the discs. And we also know that eating too much of the wrong foods dries the discs out, and certain chemicals and toxins that we're breathing in and drinking in and are in our food also make the discs more brittle and toxic and dry and crack. Which is why we're now able to see people who've had multiple failed back surgeries and we still manage to repair their discs. Because we take people through a number of procedures. Okay. Now the other thing that we really must make you aware of is that when these outer layers are damaged, what we're now finding is that nerves actually start growing into the disc itself, which is why it's a worsening process. I'm going to get back to that a bit later. So we have a set series of procedures. We don't just look at diagnosing you with a disc problem. The chances are you already know that. So the diagnosis doesn't really help. What we need to know is we need to find out what your healing capabilities are, what your lifestyle is. And this is why we have an examination process and a case history to find out what are your healing abilities, what's wrong with your healing abilities, and where are we starting from? What do we need to do for you as an individual? We can then start applying procedures to get your body moving again. We can give you the disc nourishment program, which is both nutrition and exercise. We can also look at giving you the right strengthening program to boost a specific hormone in your body that protects your nerves from damage, and higher levels of this hormone are related to better outcomes for disc problems and nerve regeneration. We then teach you what you need to do on a daily basis to make sure that this never comes back. Okay, so let's move on to two of the biggest mistakes. Two biggest mistakes are, first one, relying on painkillers. Now, simple painkillers like paracetamol have been shown to be of absolutely no use to back pain. Reason being is they actually stop one of the most important critical healing molecules in your body from working, and that's called glutathione. Glutathione is needed for your liver to work to bring down inflammation. It's needed for your liver to work to remove toxins from your body. It's needed for your kidneys to work. It's needed for your gut to work, your brain to work, your immune system to work, and it's really important for bringing down inflammation. So paracetamol actually stops one of the things you really need to do to bring down inflammation properly. Second thing, like anti-inflammatories like ibuprofen, they actually stop a critical part of the healing process, and they actually increase your chances of never getting better by up to 40%. The worst thing you can do if you have an acute sports injury or an acute back injury is take ibuprofen. It will actually make it worse in the long run, nearly always. So, what are the two biggest myths? Well, second mistake, is thinking that as the pain goes, the problem goes. Whereas what we're finding out is what's really happening is the pain might go, but it takes a further 3 to 12 months after the pain is gone for the disc to fully resorb if you're doing the right things. Because that nerve just grows deeper. As this gets injured, nerve grows deeper. You might feel temporarily better, but then it's easier and worse when it comes back. So the two biggest myths, well, one of them I've just spoken about, the fact that it actually gets worse as time goes on. Common myth is the fact that back pain resolves itself. It doesn't. 54% of the time, people have had at least 10 episodes of back pain before they come and see someone. A lot of the time as well, 61% of the time, 61% of people with back pain find that it gets worse each time that it comes back as well, because it's a degenerative process. The nerves seeping in. It's like atherosclerosis or heart disease. Just because you survived a heart attack doesn't mean you're better. You've got to change your lifestyle. Same with a slip disc. You've got to change your lifestyle. You've got to change how you're eating, you're exercising. You've got to change, otherwise it won't get better. And we can teach you what these changes are. The second big myth is that surgery will fix it. Again, there's hardly any evidence that surgery works. According to Spine Journal in 2008, they found no real evidence that spinal surgeries work for disc problems and back problems. They found that the best people to see are actually people who are trained originally as chiropractors or osteopaths, because you're more likely to actually get better if you see them than go down the spinal surgical route. And we commonly see people who've had 1, 2, 3, even 4 failed surgeries, and we can still help. So now you know that there is a 90.5% success rate with what we do. What's the next step? Well, the next step is for you to give us a ring, call 01707 662 704 and ask for a disc fix consultation. Now, if you go to an orthopaedic surgeon, a consultation may cost £250 and you're just going to find out whether or not you need surgery or not. What we can do is we can give you the next steps. We can show you what you need to do. We can give you things that you can start doing right now. So you can get out of pain, you can get mobile, and you can start doing things daily that are going to start your healing processes and give you control rather than the pain controlling you. Now you must hurry because we can only really fit in 100 people into our total disc solution program, which looks at all of these things so that you can actually get better once and for all. And remember, it's a degenerative process. As that nerve grows in, it decreases, or it doesn't really decrease the chance of us actually being able to help you. It just takes longer for it to work for you. So please pick up the phone, give us a call, and we will go forwards and get you feeling healthy and well again and give you your life back. Be well.